Good day, class. In this video, we are going to study jaundice. Jaundice refers to the condition that when the skin, sclera, mucous membrane, and even the urine become yellow. This is a symptom. Until now, you will see this in Chinese medicine. We use the disease, we use the symptom as the disease name. We treat the diseases according to the symptom, according to the pathogenesis behind the symptom. So we don't only focus on the symptom, but we focus on the pathogenesis behind the symptom. From this point of view, we will treat the diseases regardless of the actual cause. For example, for jaundice, no matter it's from the hepatitis or the gallbladder problem, or the parasites, our treatments should focus on relieving jaundice. But in the meantime, we also need to focus on the original cause, such as if from the liver, we're going to focus on the liver, if the gallbladder, we're going to focus on the gallbladder, or the parasites. But the main treatment for jaundice specific disease, we will focus on relieving the jaundice itself. So that's slightly different from conventional medicine. Just we need to remember that we focus on the pathogenesis, but in the meantime, we also need to consider the actual cause to relieve the cause of the disease. Jaundice, very similar to the other diseases that we have discussed, such as abdominal pain, constipation, diarrhea. This disease has been documented for a very long time. So from 黄帝内经, we already have a very detailed explanation of jaundice. In 伤寒杂病论, the author Zhang Zongjing already categorized jaundice into 5 different categories, 5 different types of jaundice, and according to these different types, the author gave us the explanation of the pathogenesis as well as the treatments. And further on, in some comprehensive theoretical books, jaundice was further divided into 9 different types with 36 different types of yellow. So we'll come to the observation. The yellow, you can distinguish the yellow color. Yellow is not only yellow, the bright yellow, mild yellow, or gray yellow, or dark yellow. So all these different types of color may help you to identify the cause from Chinese medicine, to identify the pathogenesis, what causes the jaundice. The explanation of jaundice, the explanation of the yellow, traditionally, we have 2 explanations that we still using today. Firstly, yellow. The color yellow is from the spleen, is the color of the spleen. So for the yellow, why the yellow color presents on top of the skin? In our theory, we think that's the spleen deficiency. The spleen lose the control of to hide the color internally, which is supposed to be internally. So firstly, the jaundice can be explained from the spleen, from the theory. Secondly, in Ming Dynasty, which is about 800 years ago, 700 to 800 years ago, the author Zhang Jingyue, in his books, he proposed that the jaundice is the leaking of the gallbladder juice. So as you can see here, as the medical system developed, as the theory developed, we understand that the jaundice is the gallbladder, from the gallbladder juice goes out of the gallbladder. So these are the two explanations of jaundice. One is from the spleen, the second is from the gallbladder. But these two are also related, the wood and the earth. So our treatments, we may focus on both. The etiology, although you can see here, I didn't write in details the possible causes. As for jaundice, no matter what causes, they may be heat, dampness, coldness, toxicity, T stagnation, blood stasis. So even if it's not here, you can refer to your textbook or refer to the internal medicine of Chinese medicine. They have a more comprehensive explanation. But among all those pathogens, dampness is one of the most important pathogens that we need to focus on. So our treatments need to focus on dampness. The syndrome differentiation, jaundice can be divided into yang jaundice and yin jaundice. Yang and yin jaundice is according to the color. Bright orange discoloration or dark orange. The brightness, so for yang jaundice, we emphasize the brightness. Yin jaundice, we emphasize the darkness. Yang jaundice also can have the sudden onset, the short duration of the disease. The patient may accompany with fever, bitter taste in the mouth, dry mouth, yellow greasy coating while repulse. In jaundice, the patient will have a dark or gray facial complexion, accompanied with fatigue, poor appetite, pale tongue. Longer duration of the course of disease. So that's the main differences between yang jaundice and yin jaundice. This is very important, so you have to memorize. Even it's not on the notes, you need to add those sentences that I have mentioned. This is also very important for your test because you must know how to identify them and in order to have a correct treatment, because these two are in two different categories. One's yin, one's yang. Your treatment principles will be very different. As I mentioned previously, jaundice, we're going to focus on dampness, regardless of what kinds of pathogens. Dampness is one of the most important pathogens. But dampness can be dampness accompanied with coldness or accompanied with heat. So cold dampness or damp heat. The same dampness, it can change into damp cold. You also can change into damp heat among patients. We will never know this dampness is going to change into cold or heat. This will depend on the patient's body constitution. So where does the dampness come from? Maybe from the diet, maybe from the environment. But this dampness, once it affects the organs, such as the spleen and liver, this dampness can be transformed into damp cold or damp heat. If damp cold, your treatment principle will be warm and it will be clear the heat. So if the damp heat, your treatment principle will be clear the heat. For damp coldness, the treatment principle will be clear the dampness and tonify the spleen. So that's very different because of the the body constitution. Why this dampness can be damp cold or damp heat? That's because of the body constitution. The pathogen will change according to the body constitution. This is very similar to the metaphor that I said for 2 glasses of water, one's hot water, one's cold water. You pour another room temperature water to the cold water, the room temperature water becomes the cold water. If you put the room temperature into the hot water, the room temperature water becomes warm. The same room temperature water, why it can change it to cold or warm, it depends on the body constitution. Same as here, the dampness. The dampness enter a patient with a body constitution of heat. As the heat, yang, it is easier to transform into damp heat. If a patient suffers from spleen deficiency, spleen yang deficiency, it is easier to transform into damp coldness. The treatment principles for jaundice, it will depend on which type, yang jaundice or yin jaundice. So you're going to use different principles. The points you can use, no matter which type of jaundice, we're going to focus on clearing the dampness. And one of the most important technique of clearing dampness is inducing urination. So increase the urination if you can. Either use herbal medicine or acupuncture, or even if in homeopathy you have something to induce the urination, you also can use. That's one of the most important treatment principles for jaundice, induce urination. The main points: bladder 19, gallbladder 34, spleen 9, do 9. Do 9, this is the points from experience for jaundice specifically. Spleen 9 can tonify the spleen and clear the dampness. So that's why I said that one of the most important treatment principles is to clear dampness. We're going to induce the dampness from urination. Backshore points. The low C points of gallbladder. So we're going to focus on the gallbladder, liver, and spleen, because the liver problem, the gallbladder problem, the wound may affect the spleen. For specific syndrome, yang jaundice, because of the heat, you can add stomach 44, level 3. You also can add Dew 14. Dew 14, you can use the prick technique to cause bleeding. Yang jaundice, heat, yin jaundice, you can strengthen the spleen. Round 12, the food organs, summer 36, strengthen the spleen and stomach. Nausea, vomiting, you can use for, and then you can add something on to help the specific symptom. Constipation, diarrhea, summer 25. GP12 to strengthen the function of the gallbladder, relieve the jaundice. Moxibustion may be added into yin jaundice because yin jaundice is cold, efficient. Ocular acupuncture you also can use. In this video, we mainly discuss the treatments of jaundice. Although acupuncture can be used for jaundice, but in clinical practice, we don't really use acupuncture only to treat jaundice. The reason is because for jaundice, if you want to treat jaundice, you have to use herbal medicine, or at least the combination of herbal medicine and acupuncture if you want to enhance the effect. So we don't really use acupuncture to treat this problem alone. When we see this kinds of diseases, we also need to be very careful to consider what the causes are, because some jaundice depends on the cause which results in jaundice. Some of the diseases are communicable disease, such as the hepatitis. So when we see these patients, we need to be careful. As a practitioner, you need to be careful. You also don't want to transfer the disease, the virus, from one person to another person. So that's something you need to be careful. The quarantine, if due to hepatitis, the quarantine is very important. Thank you for your attention. For some jaundice, when we see these kinds of patients, we need to give some advice for their recovery, such as from diet, the hygiene diet, and the proper diet. Don't eat anything greasy. Reduce the spicy food and alcohol intake, especially the alcohol intake. It must reduce. For some diseases, for some jaundice, due to communicable diseases, the quarantine is very important. Firstly, the quarantine. The second is the utensils, such as the plates they use. They need to wash separately. Patients also need to rest well, so don't stay too late at night. They must rest well.